You're listening to the Shamash Alidina radio show. Listen, learn, enjoy.
You're listening to mindfulnessradio.com. My name is Shamash, and today we have the privilege to have Professor Mark Williams. Mark is Professor of Clinical Psychology and Director of the Oxford Mindfulness Centre at the University of Oxford in the UK. His research focuses on how best to alleviate depression and suicidality. Previous publications include Mindfulness, a practical guide to finding peace in a frantic world, which is an excellent introduction to mindfulness, and also The Mindful Way Through Depression, which is based on MBCT. So first of all, thank you very much for joining us today, Mark.
It's a pleasure.
So the first question is, you've developed mindfulness-based cognitive therapy, MBCT, and you continue to research it. First of all, could you just basically explain what MBCT is for those that don't know?
It's a combination of the MBSR program, that's the Mindfulness-Based Stress Reduction program that was developed by John Kabat-Zinn in the United States for chronic pain in the late 1970s and early 80s. And a combination of that and also some of the learning that was derived from cognitive therapy for depression in the 70s and 80s. So putting that together, the mindfulness-based cognitive therapy program takes people through an 8-week, usually a class-based, people usually do it in a class, they can do it from the book as well, but usually they come to class, and they learn how to do a form of mental training called mindfulness meditation, which helps increase focus, increase concentration, but also allows people to see clearly when thoughts are getting on top of them and they're ending up brooding about things in the past or worrying about things in the future, which are taking them away from the present moment in ways that are unhelpful, but which they can't do anything about.
Okay, thank you. And how does MBCT compare to something like taking antidepressants or seeing maybe a CBT therapist on a one-to-one basis?
Well, one of the things is that, first of all, you get the benefit of a class. You meet other people that are doing the same program, and that's, some people find that very helpful. Secondly, that it doesn't have to be done taken instead of antidepressants. People can continue to take their antidepressants if they're on antidepressants, and we'd never advise people to come off without the doctors say so anyway. But the research suggests that you can do MBCT with or without antidepressants. But the research also suggests that if you want to, if you've got a problem with antidepressants, that MBCT is quite a good alternative. It's as effective as antidepressants in preventing new episodes of depression, but it should always be done with the under the guidance of a physician, because some antidepressants, they're quite difficult to come off depending on exactly what it is, and so you need the guidance there. From a point of view of comparing it with CBT, CBT is a really very effective treatment for many, many people, and much of the MBCT was informed by the success of cognitive therapy. But CBT originally was for people who are depressed right now, and MBCT was devised for people who are known to be vulnerable, but they're not depressed right now. So they wouldn't be seeking treatment right now for the depression. If they do, they'd probably go for cognitive therapy. But if they're just fed up with getting depressed again and again and again in their life, then they might want to use the opportunities in between a really bad episode to actually learn some skills to stay well. And that's the focus of the original MBCT treatment.
Okay. And is it still recommended for people who've had 3 or more episodes of depression?
That's right. So in the NICE guidelines, the UK government guidelines, it's recommended for people with 3 or more. That's because the early evidence suggested that those are the people who benefited most from it. However, we do know that it's probably not the number of episodes which is critical, because the people who were most helped not only had more episodes, but they'd started their depression early, and they'd, maybe in teenage or early 20s, and also they'd had quite a lot of problems as teenagers, and got depressed not only rather early, but maybe had some problem in relationship with their parents and friends. They perhaps suffered a lot of adversity as teenagers. And that's all summed up in the 3 or more episodes injunction. And part of our research has been trying to pull that apart and say, well, which of these things are actually the critical clinical predictor And that's part of the ongoing research, which will be published over the next year or two, I'm sure.
I see. Okay, that's interesting. So, what areas of research are going on at the moment at the University of Oxford on mindfulness?
Well, one of the things we're interested in is whether mindfulness can help people who are vulnerable to depression at an earlier stage in their life from the time that we normally see them. So one of the things that we've found out and published is that for those who are recurrently depressed throughout their life, that can start very early. And indeed, half of the people who are going to end up depressed later on in life get depressed before the age of 18. And the most common age before the age of 18 is between 13 and 15 years old. That's what we found in our Oxford data, and that repeats work that was done in the United States a few years ago. It exactly replicates that work. So one of the questions is, can we offer something earlier on to people to prevent a lifetime of depression? So we're supporting mindfulness in schools, which is an organization to bring mindfulness to schools, and school kids really enjoy this stuff, and they don't have to be depressed to enjoy it and to do it. They get a lot of benefit for their own ability to study, to focus, to concentrate, to sleep. All of those benefits have been found in the classroom. But also, once people have left school, there's still an opportunity to teach mindfulness to those, for example, when couples are having babies. We know that many people get depressed around the time that you have a baby, both men and women, actually. Postnatal depression in men is almost as common as it is in women.
Wow.
And there's all sorts of possibilities there, especially since women are not advised to take antidepressants when they're pregnant or breastfeeding. We need alternatives, and we need preventative alternatives. Instead of just waiting until people get depressed, actually being able to offer something even before people get depressed. And since most young couples or older couples come when they're having a baby to the health service asking for help in preparing for childbirth and early parenting, it's a golden opportunity, I think, to offer not just breathing exercises to get through the childbirth, but mindfulness breathing and mindfulness practice. And so in Oxford, we've got a big project starting off on teaching midwives mindfulness so that they can teach the people in their care how to use mindfulness in those sort of contexts. And that's probably the next generation of research will be on preventing depression in these particular groups, not just waiting until people have had half a lifetime of depression in their 40s, 50s and 60s.
Sure. It sounds like, so the idea is to prevent the onset in the beginning and find those moments in people's lives when there's high levels of stress, I suppose, and to catch it.
Absolutely. And if we can do just a little bit in that area, it will mean an awful lot.
Excellent. That's really interesting. Okay. So what areas of research are you kind of most excited about, whether it's at Oxford or outside of Oxford in the field of mindfulness?
Well, the field of neuroscience is going on in very big ways. We now know that the brain changes not just functionally, but structurally over an 8-week program. One of the things that one of our colleagues in Germany has found is that when people are pretty non-mindful, when you're rushing around all the time, you're doing things, then the part of the brain that governs emotion, a particular part called the amygdala, it's like it's stuck in the on position, so that we're chronically overstressed and looking for dangers even that aren't there. And our brain is just basically putting us on full alert even when we don't need to be. And what Britta Herzl in Germany has found is that as people go through an 8-week mindfulness program, not only do they feel less stressed on things like the perceived stress scale, which is a very commonly used scale to measure stress, but it's a self-rating scale. And people would say, oh, well, maybe they just filled it in like that because they wanted to please their teacher. But their brain actually changes as well. The amygdala, certainly on the right-hand side, actually shrinks in size. And the relationship, there's a very strong relationship between the structural changes in that part of the brain and people's benefit that they report on the self-rating scale. So we're seeing changes in the brain with these mental trainings. I mean, we've always known if people learn to juggle or learn to play the piano or learn another skill, the brain's got to change, because eventually when you can play the piano and when you can juggle, then it's all learned, it's all encoded in the brain. What we weren't sure about is whether sitting on a cushion or a chair for 8 weeks, focusing on your breath, noticing your thoughts coming and going, and that thing, whether that would change the brain. And that's now, lots of research is showing that that's happening.
Okay, so would you say that the main effects on the brain are this part of this area of the brain, the amygdala? Is there any other main parts of the brain that mindfulness seems to affect?
Different studies are producing different results, and it'll take time for the field to settle down. But there's another part of the brain that many of us are interested in, which is part of the cortex, not the deep down, the amygdala in the old brain, but part of the neocortex, the new cortex, the newly evolved cortex, if you like. And there's a particular part called the insula, which receives input from the body, body sensations, not just the surface of the body, but deep inside the body, your visceral sensations and so on, your gut feelings, basically. Mm-hmm. And it's a bit of a way station. It sort of receives and body signals to converge on this part of the cortex, and then it relates to the other parts, the frontal part, the more executive parts of the cortex that are about planning and making decisions. And what we know from people who've meditated a long time is that this appears thicker in those who've meditated a long time. But more interestingly, those changes begin to occur only after 8 weeks of training. So you begin to see the insula being activated by the practices in mindfulness. And what's more, in some studies, it looks as if the body sensation part of the brain lights up when you do these practices, but it doesn't activate all the sort of the story parts of the brain, the sort of the parts that actually underlie the way in which we think constantly and often relate everything to ourselves and our own story. Mm. It's not that that's a bad thing, but it's good to be able to stand back from it a bit and see what's story and what's true. And what some work by Norman Farb has done with his colleagues Adam Anderson and Zindel Siegel in Toronto has found that the insula lights up, is part of the neocortex, but it doesn't necessarily, after mindfulness training, create a cascade of thinking as it does in novices. So the work is still going on all over the world. It's still fascinating, and we look forward to more results from the brain scientists.
So that's really interesting. So this storytelling part of our brain could be connected with the rumination and the worrying that so many of us do. And mindfulness seems to help us to kind of connect more with the present moment and detach from that.
That's right. Because one of the things you notice about rumination, it's never, well, very rarely ever about the present moment. It's usually about ruminating about the past or worrying about the future. Or if it is focused on the present, it's about the implications, what does this pain mean about me? What does this tiredness mean about me? What does this anger mean about me? I shouldn't be angry. I shouldn't be in pain. I should be over it by now. Whatever. It just goes round and round and round. And it's not that rumination is the enemy that we have to somehow eradicate. We don't have to get our guns out and try to shoot it dead. It's basically being compassionate with ourselves and our mind, and making a broader space for this to carry on, and not fueling it in ways by imagining that this is the only way we can solve problems. And that's what mindfulness seems to be really good for. Many, many people say, at last I've got something to do, when my mind starts to go into the middle of the night thinking, and I just can't stop it. I've now got something to do there.
You mentioned the word compassion, and there's, I'm starting to hear that word a bit more, especially in areas of research. And obviously, there's an overlap between mindfulness and compassion. Do you think in the future there'll be separate trainings for compassion training for the brain, or do you think it will be kind of part of mindfulness training in the future?
I think a bit of both. We know that when people learn mindfulness, that compassion, self-compassion, compassion for others naturally emerges. And but we also know that there are many scientists working on compassion as a quality in its own right. and particularly the fact that many of us are actually rather afraid of compassion. We fear it. So Paul Gilbert's work is particularly interested in fear of compassion, fear of love, fear of what we might see as softer emotions. And I think that's really interesting work. And there within the foundational Asian traditions out of which this work comes, there are a lot of practices that can explore compassion, and those are likely to be explored by scientists and by practitioners, I think, independently of mindfulness. And that's fine. It's a nice new development. But it is true that compassion is naturally evoked when people learn mindfulness practices, and we have research that suggests that very strongly. And that, in fact, sometimes it's the compassion that really helps people to get to protect themselves from future depressions. Because when their mind winds up and they start to think all these negative things about themselves, trying to tell themselves to stop doesn't work. If they can hold it and be compassionate with themselves, that seems to really prevent the rumination from being fueled by a sense of just wanting to avoid these mind states. It's more allowing, in a sense. So I think there will be further research on that. There will be further things. There may be even further trainings. My concern is that since compassion has now become a really big thing in the health service, for example, how can we get our doctors and nurses and midwives to be compassionate? That compassion might be dragged into, I'm sure this would be Paul Gilbert's worry as well, compassion will be dragged into target setting. You have an assessment, a compassion assessment. If you're not compassionate enough, then you haven't met your targets today. And I think that would be a dreadful mistake if we need compassion in the health service, and for each of ourselves, whether we're in the health service or not, it's finding a way of giving ourselves time to do this rather than just setting targets for ourselves.
Okay. In your books, in the past, you've stated that what was classified as clinical anxiety, maybe in the 50s and 60s, is almost now considered normal levels of anxiety. What do you think are the main causes for this recent rise in stress, anxiety, and depression over the last 50 years?
It's very unclear exactly what's caused the rise in anxiety and depression. It could be that people are more open about it, but there has been a change in pattern with even children and young people, as I said before, getting more depressed, and that's mimicked in the data on anxiety. The particular data on anxiety has been perhaps better worked through by scientists than the data on depression, and they believe that it's correlated with people being worried about crime, but also family breakdown. So there's the trend now for families to be, and I don't mean family breakdown just in case of divorce and separation, but family fractionation into individual units, because everybody's now got their own their thing. The mum and dad are working, the children are left alone perhaps a bit more with other carers. They get on with their own stuff. So there's a sense in which within any particular family, you've got perhaps 3 or 4 units rather than one family unit, slightly more, because people are doing their own projects. And I think that there is some evidence that fractionation is fueling, and it's the marker of it is more men and women in the workplace. But I don't think it's just women going to work that's creating their children being anxious. I think it's the consequences of everybody being very busy and being busy with their own projects. That means that, and the kids also being busy with their own projects, with targets in schools and so on, that actually is fueling quite a bit of this, reading between the lines of the data.
Yeah, that's really interesting. That's perhaps part of the reason why mindfulness is being embraced so much. So just to finish off with very briefly, maybe if you could finish with 1 or 2 practical tips that you could offer our listeners to be a little bit more healthier and happier through using mindfulness. What kind of practical ways would you recommend people can do that?
I think it's one of the things is finding the spaces during the day.
Okay.
Whether it's walking from the car park to the office or walking between offices, actually using the fact that we have quite a lot of time, if we look for it, where we're not actually doing the things that we think we're doing. We're not actually, although we're overburdened by emails and by so much to to do. We have our working through our lists. Taking time when we finished one job, even if it's only to take 3 breaths, is really important at resetting. It allows us to check in with ourselves and say to ourselves, is this what I had intended to be doing right now? Is this what I had intended to be doing right now? Or have I got drawn into doing something which was just presented to me and I'm now working on that instead of what I intended to be doing? And using the spaces of walking to and from the restroom, using from the car park, the times when we get up and walk around, doing that as a really embodied mini practice. However, it's got to be said that we are all more likely to take those spaces if we, and do everyday mindfulness, if we put aside a little time each day for doing nothing but mindfulness, whether it's 3 minutes, 5 minutes, 10 minutes. And that's why the meditations that you've presented, Shamash, the meditations we've done, other things, are quite useful to people to take a little time aside, even if it's a 3-minute breathing space. And if people don't know about 3-minute breathing space, then there are lots of them around and they can easily download them so they can get a sense of how to spend just 3 minutes. And with that structure, they can make the 3-minute breathing space into 3-breath breathing space or a 5-minute breathing space. They can take it anywhere.
Okay. That's a really nice practical way to end. So thank you very much. So I'd like to finish by saying thank you very much for your time today, Professor Mark Williams, and thank you for all the work you do in the field. And if people want to find out more, I suppose they could visit oxfordmindfulness.org. Would that be the best place?
Yes, indeed. oxfordmindfulness.org. And they'll find everything they need there.
Great. And I had a quick look there. I know that you're trying to raise some money for the next phase because the Wellcome Trust has given you money.
That's right.
So if people are able to do that, then please have a look and consider doing that too.
That's wonderful for you mentioning that. Thanks so much.
Okay. Thank you very much for your time and have a great day.